There is a Salesforce certification that almost nobody can actually take. It is called Cloud Accredited Professional, and unless you work at a specific kind of company, you cannot register for this exam, not because it is too hard, because Salesforce will not let you. In this video, I will show you 3 things: what HealthCloud actually does and why it is not the same as a hospital's medical record system, the 6 new AI agents Salesforce just rolled out for healthcare, and the real path into this specialization, since the certification everyone assumes exists is locked behind a wall most people cannot get past. If you want more videos that catch these changes before they confuse your resume, subscribe before we start. Why this matters: healthcare is one of the highest paying corners of the Salesforce world, but almost nobody explains it clearly, including the certification situation, which trips people up constantly. By the end of this video, you will know exactly where you stand, what HealthCloud actually is. Let's start with the basics. HealthCloud is not a replacement for a hospital's medical record system. People mix this up constantly. It sits on top of the regular Salesforce platform, and it manages relationship and coordination, not clinical documentation. Think care coordination between doctors, home health visits, tracking disease outbreaks, and managing complex treatments like cell and gene therapy. So a hospital still keeps its medical record system. HealthCloud is the layer that helps different teams stay coordinated around a patient outside the exam room. The 6 new AI agents for hospitals. Now, here is the part that is genuinely new. In March of 2026, Salesforce released 6 new Agentforce Health agents built with data from 3 healthcare partners: HealthX, Worley, and Viz AI. 3 of them are about speeding up patient care. 1 routes referrals to the right specialist and books follow-ups. 1 can read and write directly into a patient's medical record, so it can register a new patient or update details, not just look things up. And 1 handles insurance questions and coverage checks. The other 3 are about operations and public health. 1 works like a command center for hospital staffing and equipment. 1 automatically spots disease outbreak patterns for public health teams, and 1 is built for rural health systems, including an offline mode, so caregivers without internet can still pull up patient records. Some of these went live in June of 2026. The rest, along with the data partner integrations, are rolling out later this year. This is a real active investment area, not a side project. If you are trying to figure out whether a specialization like healthcare Salesforce work is the right move for you, I do offer one-on-one Salesforce career consultations. We look at your background and build a real plan together. The link is in the description. And before we continue, I also publish new Salesforce videos every Wednesday and Friday. If you do not want to miss the next video, hit subscribe right now. The certification problem explained. Now let's talk about the certification, because this confuses a lot of people. There is a credential called HealthCloud Accredited Professional, exam code AP211. Here is the catch: this is not open to the general public the way Sales Cloud Consultant or Service Cloud Consultant are. It is restricted to Salesforce partners with access to something called the Partner Learning Camp. So if you do not work at a partner company, you cannot register for this exam right now, period. For reference, if you are able to take it, the exam is 60 questions and you get 90 minutes. It costs $150 per attempt, and a retake is also $150 with no discount. As for the passing score, you will see different numbers floating around online, so check the official Trailhead page for the current one before you book this exam. Right now, there is no yearly maintenance module required, unlike most standard certifications, but for most people watching this, that exam is simply not available. The real way in. So here is what you actually do instead. The Trailhead learning content for HealthCloud is public. Anyone can study it, build hands-on projects, and put that experience on a resume, even without the credential. Pair that with a general certification you can actually take, like administrator or Sales Cloud Consultant, plus real HealthCloud project experience, and you have something real to offer. And healthcare focused Salesforce work pays well. Salesforce developers working in healthcare average around 140K a year compared to a general Salesforce consultant. So let's bring this all together. HealthCloud manages patient relationships and coordination, not medical records. Salesforce just released 6 new AI agents for healthcare built with real outside data partners, and they are actively rolling out right now. And the certification path here is different from every other Salesforce specialization. The credential exists, but most people cannot take it. The real path in is the Trailhead content, a general cert, and real project experience. If healthcare interests you, this is a specialization worth building towards, even without that one locked certification. If this cleared up something that confused you, hit subscribe. New Salesforce videos go up every Monday, Wednesday, and Friday. Drop a comment. Did you know that certification was partner only before this video? And if you want to go deeper on Salesforce skills in general, my self-paced courses are at my tutorial rack. Link is in the description. Thank you very much.